I'm really excited to be in Antwerp, a diamond, I would say, of a Belgian art and science city. And it's actually not far from where I'm born. I'm born in Willebroek. I'm Belgian. And maybe some of you know Willebroek because there is very good duvel beer. I'm also really thankful to the organizer to be in this particular room and that you united us here in the Zoo of Antwerp, where my brother Bob and I, more than 50 years ago, got a prize in the Belgian Lego competition. Remember the Legos? So in this presentation, the focus will be indeed on what are all the Lego blocks or pieces that can enhance our pandemic defense through the strategic use of methods, good methods, smart methods, powerful models, and data sharing initiatives. For this, we should use, as we all heard in the previous talks, an approach that aligns closely with the overarching principles of open science and the 3 T's: transparency, transdisciplinarity, we heard that, and trust in the methods, model, and data we use for science, regulatory science also, decision-making processes. So I'm part of the Joint Research Center team of the European Commission, and I'm based in the Italian site in Ispra, near the Lago Maggiore. The GRC teams provide independent, evidence-based knowledge and science, supporting EU policies to positively impact society. Our GRC sites span across different parts of Europe, reflecting our collaboration across borders. As we reflect these 2 days all together on the challenges we faced, are facing, and currently will face, it's important to remember the historical context of the pandemics. We've seen a few examples also that have shaped our world since the 1900s and before, as Irene showed, and our collective science to be prepared for pathogen X. Before going deeper into our GRC breadth portfolio, the critical role of methods, models, and data sharing in pandemic preparedness, as well as the importance of supporting open science and the Nagoya protocol, let's take together a deep breath and a moment to reflect on the individuals and the entire One Health ecosystem, planetary health ecosystem, affected by the COVID-19 pandemic in the beginning of the 2020s. So this picture was taken in the Varese hospital near the GRC site in Italy. This image as feeling hopeless serves still today as a continued wake-up call, reminding us of our resilience. We're here. But also prompting us to reconsider our approach to pandemics. At the GRC, we responded to the wake-up call by establishing a portfolio called Breath to better prepare and respond to new health crises and dedicated to integrating innovative methods, models, and technology with a One Health approach. The transdisciplinarity of the One Health approach is increasingly appreciated by the open science community because One Health is not just a framework. It's, as we heard, a prism through which we view in a way the interconnectedness of human, animal, and environmental well-being and the ecosystems. So as indeed presented by Marion Koopmans, it is about recognizing that our health is intrinsically linked to the health of the ecosystems we inhabit. So at the core of our breadth objectives is the provision of knowledge, cutting-edge technologies and tools, methods and models, and outreach. Outreach for sharing that knowledge and expertise with digital and experimental research infrastructures in the EU and importantly globally. To support, in this way, also the European Health Union to collectively prepare and respond to these One Health threats or planetary threats. So what I will do now is I will demonstrate with 7 case studies how we can harness the power of open science, the Nagoya Protocol, and artificial intelligence-assisted tools. So I like to begin with a clear science for policy support case study. So working together closely with the Directorate General for Health and Food, DG Sante, as well as digital EC entities like Digit and Connect, and many others, we responded to an unprecedented COVID-19 emergency. So together, we tried to develop tools and methodologies to facilitate the implementation of the EU digital COVID certificate for testing, and used. So to achieve this, the GRC established a repository of data on COVID diagnostic tests and detection methods. And additionally, we coordinated with European member states experts to evaluate the performance of the test intended for the certificate, because on each of your tests you got a method listed. So this acquired knowledge that we had has now been made open access and available in a detailed report to be prepared for these future pandemics and One Health threats. For this, we heard that this morning also and this afternoon. Integrating with partners is critical for us at 2 levels. Of course, first, internally also, breaking silos. We leverage our GRC health preparedness platform, and externally, we established and are establishing more strategic partnerships in the very complex stakeholders ecosystem, made up of policy DGs, several agencies and global stakeholders, and this slide is by no means all of them, so I put a big at all, to tackle infectious diseases of global concern with a One Health approach. So for pandemic preparedness, methods, models, and data played a critical role to address the need for effective medical and alternative countermeasures and reliable and relevant early warning and surveillance systems for instance, both airborne, vector-borne pathogens, but we all heard about others, and vectors. As you know, they can be mosquitoes, they can be ticks, and many others. So how we do that? We integrate bioinformatics, epidemiological models, our foresight work, which is very important for preparedness, and anticipating the design of standard methods. We heard it about standardization for comparison, and also control materials and promoting open science and global harmonization. So first of all, we talk about methods. So what is a standard estimate? It comes from a standard method consisting of reliable and high quality, reproducible and relevant components. The test system is, for instance, the sample you take. So, for instance, the COVID-19 nasal swab, which sometimes went very deep. And the test system can be also a cell or subcellular fractions or a tissue sample, where you measure something using a detection methodology, an endpoint, a biomarker, and where the data obtained can be practically be applied to real-world questions, such as, are you infected by a pathogen or not? So after the concept of, let's say, good, standard, harmonized method practices, also for data comparison, we can zoom in a little bit on the importance of open science and the Nagoya Protocol. So open science, again, what does that mean? It's the practice of making scientific research accessible to all globally. The Nagoya Protocol, which complements the Convention of Biological Diversity, aims to ensure when genetic resources, like those from pathogens, are used, the resulting benefits are shared fairly and equitably. So while we know that open science, open data sharing is really growing, true equity is complicated. We discussed that just now. By, for instance, ownership laws, intellectual property rights, and many other things. So currently, we all hope for this pandemic accord to better manage the sharing of not only pathogen genetics resources, but also ensuring global fairness in future pandemics and health crises, and one health crisis. And this effort is really key to collaborative and equitable scientific, but also policy and governance landscapes. So, capitalizing a little bit from the COVID-19 efforts and taking it as an opportunity, as something positive, we recognize today that the pandemic in 2020 necessitated really fast results for the obvious reasons. So, of course, the quality was not always balanced. So, quality, equitable, and fair scientific processes and sharing are key for pandemic preparedness. What does that mean? It encompasses the sharing of methods, models, knowledge, data, procedures, standards, workflow, outcomes, conclusions, and also insights. So fair data, for instance, should not only be confined to the data, but we also need the metadata. And also avoiding, we heard that also, that due to human or digital bugs, everything has become now digitalized, the so-called new pathogen mutations entered the global databases, which happened also during the recent pandemic. So here you see a little bit the slide with all the components, and in the middle, obviously, sharing is key. Also today, in different presentations, we saw the case of the bird flu. So rapid sharing of pathogen genetic resources like now, actually in the US is done for the bird flu genomic sequences and the location. It is crucial for tracking outbreaks. And this is the second case study I want to share on something we did. So what we did now at the Science for Policy interface, the BRED teams, they developed now 2 RT-PCR methods for H5N1 bird flu detection. These methods are obviously crucial for rapid detection in clinics, in animals, but also in food, as was explained. And they are now shared already with labs in Europe, but we have to make this also globally. So in the portfolio BRED, after our wake-up call, we're working on 4 interconnected projects, but we're connected to many others. And not only on standard methods and control material, but also using artificial intelligence, it was mentioned, supporting our laboratory health technologies, our wastewater surveillance methods, and we have others, or also to look at disease epidemics now, which lead me into the third case study. So where we collaborate with these level 1 and level 2 partnerships, as I showed before. So sharing within host, it's also at the individual level important. We saw vulnerabilities within host infection dynamic models and understanding pathogen transmission change within a region or co-circulation of multiple variants in different geographical locations was crucial and still is crucial for everything what is ongoing now. So additionally to these activities, we have developed through our research work event-based and indicator-based systems for infectious disease surveillance using now AI tools. So during the COVID-19 pandemic crisis, collaboration was also key to deal with complex human body systems dynamics and kinetics and specific disease mechanism. So we saw it all, an extraordinary amount of COVID-19 research knowledge and data urge us really, and here we brought together 80 scientists from 50 institutions worldwide to collaborate in a kind of monumental project called CHOW. So this is just to illustrate that through open science principles, we established structured frameworks for systematic organizing of research data, unraveling the different adverse outcome pathways associated with the COVID-19 disease feature, identifying also specific modulating factors so that some parts of the population showed that we had more vulnerabilities. Not only, obviously, human-centric, but we saw that also in the animal population. In this case study 4, we show, and there was a call for action before the coffee break, that sharing, anticipation, immediate response and adaptability, flexibility is really key for pandemic preparedness and response. And as I just showed with the bird flu example, also during the COVID-19 pandemic, 1 month after the outbreak, the GRC teams developed control materials for the RT-PCR testing and dispatched the vials across the EU, at that moment filling a crucial gap by providing positive control materials, enhancing testing accuracy, and reducing some of the false negatives. So now more than 1,500 laboratories and hospitals worldwide use our control materials. We tried also to respond immediately when the Omicron variant was reported by the WHO in the end of 2021, designing the Omicron RT-PCR method. Remarkably, this method was validated by European labs in less than a month, demonstrating also its sensitivity and specificity. Rapid flexibility, adaptability is really crucial during pandemics, since as the virus mutates and evolves, also the detection methods must adapt accordingly. So with each genomic change, there is a risk that the virus could evade detection. So to address this challenge with the breadth themes, we developed methods tailored to detect, for instance, specific variants for the Omicron and now the Pirola. Additionally, we've created universal methods capable of detecting any variant, relying on ultra-conserved elements that have remained unchanged throughout the virus evolution over the 4 years. Shared is put on the slides as something we really feel very strong about. United against pandemics, and I know in the audience there are also colleagues of Belgium working on these particular types of methods. United means also meaning the availability of cutting-edge technologies and capacity building via also our European reference labs for high-risk diagnostics for public health. So in this case study, we demonstrate, just for your information, some of our efforts in also detecting airborne viral particles through advanced image analysis and AI technologies. We've developed automated identification systems, enhancing the reliability and relevance of our data for decision-making. Our 5th case study highlights, as just mentioned, the importance of capacity building via laboratories, including our European reference laboratories for high-risk diagnostics in public health. So with the support from our organization, but also with partners in the EC, like DG Sante, ECDC, the European Medicine Agency, etc., we've collaborated to select and design 2 tests for EU reference laboratories. And labs are really essential for addressing serious cross-border public and, we heard, veterinary health threats. And in this particular regulation, we focus on the regulation for in vitro diagnostics. The next few slides focus on the case study 6. United Against Pandemics means also that we need methods that can detect many things. So it can be using wastewater surveillance systems. So a critical part of our work is really symbolized by this water drop. So the surveillance extends beyond pandemics to address broader One Health and planetary threats caused by pathogens, for instance, like we mentioned it also, antibiotic-resistant bacteria or flu viruses, but also One Health threats caused, for instance, by chemicals. You see on the slide prescription drugs. It could be depression drugs, it can be any drugs, or chemicals like pesticides or household cleaners. So what we actually want in all the matrices, so air, soil, water, we want universal, also accessible methods, accessible to all, that can detect pathogens, chemicals, or their combination in a relevant matrix. So for instance, as this example, wastewater drop diagnostic methods are really leveraging, in principle, the full power of the One Health approach and provide methods accessible to all globally. On this slide, you see wastewater surveillance processes as an example. So you can do that in urban, but also in distant rural communities and the analytical workflow used. It starts from in the middle from the sample, then its concentration and the extraction and the analysis, and standard methods and control and the related reference materials are again key for avoiding false positives and false negatives. But there was another call for action, also by you as the audience. With these methods, we want even coverage from high income to low-income countries. And I invite you, one of our colleagues was also part of this Nature publication, so that actually measurements like that can be accessible to all. So the EU Wastewater Observatory for Public Health embodies, as an example, a collective One Health approach, engaging also in the different regions, the national contact points. We do town halls and stakeholders in strategic meetings. On this slide you see also, for instance, you can draw in airplanes also the water from the toilets there to see contamination. So there are global efforts now to look also at new ad hoc exercises to do these types of detection. This is the Encyclopedia Coucke, which is in a way a fantastic instrument because it's accessible for all, for global standardization and harmonization for wastewater observation. And I invite you all to go on the site and look at the different images that are there for collective harmonization, understanding what we're talking about. And also this year, now in March, the Global Consortium for Wastewater and Environmental Surveillance for Public Health, GLOACOM, was established as an open, free, global sentinel system. So we are working on the collective One Health level, but we need to do more. So these were some examples, and from these examples, I just want to end with a few take-home messages from our breath work, but also really working together horizontally, breaking the silence with our partners. We have the following key messages drawn. So first of all, integration. Our projects integrate really diverse outcomes, providing cross-disciplinary, but also really transdisciplinary solutions. Trust, data sharing. So we really need to also build more trust in the shared health data. And addressing exactly these existing threats, like the bird flu and other global concerns, such as the antimicrobial resistance, but also, for instance, mental health as a silent pandemic. Commitment to open science. We are committed to open science principles and align with the Nagoya Protocol, while enhancing material, method, model, and data sharing. It should be in our DNA. Standardized practices. We have to promote some standardization. We have that also during the talk of the clinical trials. We need to promote some kind of standardized practices that are trust, because it's about trust worldwide, but ensuring equitable access to crucial One Health data and resources, and support for all. We aim to support countries with fewer resources to join the fight for better health outcomes. So again, I would like to conclude with a breath and a reflection on the individuals. There is also Médecins Sans Frontières here, on the individuals behind the pandemics and their crucial role in addressing them. So on this photo, you see two medical doctors that I know of Varese Hospital, who became, both of them, the biggest advocates of method, model, and data sharing importance and open science with their quote, "As we look to the future," because the situation was near Bergamo, where pandemics may challenge us again, our shared methods, models, and data will serve as our shields. By embracing open science and recognizing our interconnectedness, we can confidently face any challenge that comes our way. So it's a message of hope. So I want to express now, because the work, I'm just an ambassador of the work of many colleagues, so in a huge ecosystem. So I want to express my gratitude to all those involved in the work presented here, because it is the result not of a rational mind, but of passion for science, for policy, in our case, dedication and collaboration of a great team, and want to again to highlight the One Health or planetary health interconnectedness within the complex ecosystems we inhabit. We need to protect it for protecting ourselves. So thank you all for listening to that, and I look forward also with some of the colleagues here to take any questions if I'm able to answer them. So thank you for your attention.
Whom may I pass the microphone to?
Thank you for an interesting overview. So I have a question on, so JRC seems to be self-tasking a bit, and I'm wondering, because there are networks of diagnostic laboratories funded by, or coordinated by ECDC, by other organizations that do very similar things. How do you interact? There's the AVA-G for sharing, there's the, so how does that interact? I wasn't aware that JRC was...
Thank you, Marianne, for this question. So this is actually an excellent question, because what I showed is the work of this collective effort. So we were part of, let's say, appointment also of these labs together with our collaborators in the different agencies and policy DGs. So it's a collective effort, and exactly we have now also these networks. We have many networks. So what I want also to say there is also GRC should not be a silo. So many of the case studies, we work together with RTD, with ECDC, with ERA, with all the different agencies. So, and we see in our case what is our added value. So we were part of the selection committees for these networks of the in vitro diagnostics and public health. So we work together on that. And I think it was this wake-up call in the Commission, because, you know, the EU has formed as a collaborative spirit. And I think during the COVID pandemic, actually also our colleagues here organizing the conference, RTD is here, we are here with many. I think this collectivity in our work, and also know what you have to do and what others are doing, and putting that together. And sometimes we didn't know what others were doing. So working together, understanding who is doing what, avoiding duplication of effort has been very critical also for us in, let's say, the EU, the European Commission ecosystem.
Hi, Sandra. I think we studied together
I-
a long time ago.
I thought I recognized that face, but I said it one time to President Mario Monti in an airplane. I said, I know you from somewhere, so I'm very careful to do that still, because he said, you know, I'm the president. I said, I saw you on television.
So you mentioned quite a number of times the concerns on or the objectives of equitable access and sharing and openness, etc. But I think we've heard already in previous conversations that this has been a big challenge, and certain things are open. But if the whole is not open, or in the right things are not open, we have all the problems that we have faced, and so. Yeah, I would like to have your comments a little bit on that, because, I mean, as I think Michelle also indicated, Europe has not always been a stellar example of openness and sharing and dealing with intellectual property rights towards equitable access. So, yeah, maybe you want to comment.
You know, I want to say that with a metaphor. I think if we dare and if we try, we are not a drop in an ocean, but just daring and speaking up like we're doing today, without fear, will break some of these silos. But it is really challenging. And any kind of change, you know, just, you know, gives resistance. So I think it's really, being here today, for me, is a positive sign. So I've been always trying to stay passionate, enthusiastic, by doing what is in my control, because I cannot control the others. But you know, we have mirror neurons. I know I also have done some neurotoxicology and neuroscience. So if you laugh, maybe somebody else laughs. If you really want and you try, and we try to do that together, and we've seen that at the GRC, you know, my colleagues are there. Besides that we do this work together, we have also lots of fun together. So I think I think we really have to be brave and dare to speak up in of course, with a non-violent style of communication, but just believe that we have so much to offer still if we work together, but also not see only human-centric, you know, see it like Marion said it very nicely with her conclusion, planetary health, you know, everything is interconnected. And I think this meeting today and tomorrow is a start of being brave.
Thank you very much.